Good morning, everyone. I'd like to call to order the Incarceration Prevention and Reduction Task Force Steering Committee meeting for December 10th, 2020. It's 11 a.m. and we are meeting virtually. So our first item is the 2021 Incarceration Prevention Reduction Task Force and Committee regular meeting schedule. So Jill, do we have something proposed? You're on mute.
I have an annual calendar and I have the list of meeting dates. Let me just share one, and if you'd like to see the other view, you can. So the outstanding question, I believe, is still Behavioral Health Committee, and they're going to discuss their schedule at the meeting next week. And I think that's all that we have as far as my questions. I just wanted to put this before you.
Okay. Raylene.
I want to say that for some reason in the back of my mind, I thought we were just going to double check with Legal and Justice at our next meeting in January to confirm we wanted to stay on the same dates. I want to say we talked about the first or third Tuesday, but I'm not positive. And I think we were just looking to confirm that. And if everybody wants to stay where we're at, then nothing would change.
Yeah, and this schedule can change as those conversations happen. This isn't necessarily set in stone. So if the committee does change its regular meeting schedule, I can easily change this document as well. So,
okay.
Mike Parker.
Yeah, thanks, Barry. Mike Parker here. Just what Dan and I have been discussing a little bit with Jill, and what we're going to talk about is actually moving ours from Mondays. There have been quite a few schedule conflicts on Mondays. So we're looking to do Tuesdays. The other thing, we did increase our frequency, but we're looking to go back to monthly and just go a little bit longer. So it would look a lot more actually like Legal and Justice, possibly on Tuesdays in the afternoons for 1.5. So I don't expect any great dissension, but we'll see what our group thinks, and then we'll be sure to let Jill know.
Okay, thanks, Mike. Councilmember Hamel.
Yeah, I think January 4th is our reorg for City Council. It's in the afternoon, so this is in the morning. Is that correct?
yes, so the full task force meeting will be from 9 to 11 as usual. And I don't know if you remember the monthly calendar that we talked about last time. Out of the 4 Mondays in January, City Council takes up 3 of them, and the 4th is a holiday. So we're kind of piggybacking meetings a little bit that first month.
That's fine.
Any other comments on the schedule? Do you want a motion to adopt or recommend, I should say?
I don't need one. If you'd like to, you certainly can.
What's the consensus of the group?
Let's just do it. I'll move approval.
I'll second that.
Okay, we have a motion and a second to recommend this schedule to the full task force. Discussion. Okay, all in favor say aye.
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 Barry,
Stephen,
I'm
sorry.
I had my mute on. I apologize.
Oh, okay.
Are we also adopting the schedule for the written reports?
Reports.
That
Good point.
information is just FYI. I don't think that needs to be adopted.
I guess I'm trying to clarify the motion then.
Didn't I read that there was a written report due this month?
Well, that's part of my question.
Okay.
So typically we've done the annual report. It's due to the council in June. There's a second requirement for a second report out at some point. There's no specific time frame given. I did a real quick summary in December, sort of a wrap up and what's next for the year. So I was thinking we would stay with that schedule this year, do the big report in June like we have been, and then in December do a wrap up of what's been done and what are the plans are for the next year. So I don't have a report scheduled due now.
So that December requirement isn't due this month, then you're saying it's next year?
The ordinance says 2 reports are required per year. One is done in June, and it doesn't give us time frame for the second. So in 2020, I did a. Now I'm gonna have to think about it. We did 2 reports. We did. Here, let me look this up.
Yeah, Jill, my recollection is that in June, we did a very cursory report saying we'd follow up once we got back into meeting. So
Yeah, that's exactly what we did in June. And
Yeah.
last December was almost similar. It was sort of an overview. It was not the in-depth type of report.
And I'm
So I-
thinking there was a small report submitted in February as well of this year. So we've already met our requirement for 2 reports for 2020.
I'd like to suggest, I think it was Dan, if I could make a friendly amendment to the motion that we adopt the schedule as set out in the grid and defer for further discussion the timing and scheduling of the report related activities.
Dan, do you accept
I'll
that?
accept it. I'll accept it.
So Jill, you have the wording?
Yes.
Stephen,
Okay,
just a question about your amendment. You're just trying to make sure we have some flexibility in the report timing, correct?
And that we have it right, because
Okay.
I think we have a couple of recollections that we've articulated so far. If any of them suggest that it's been a long, long time since the council's had a full report from us, so we might want to just think about how we want to report back to them.
Well, if we're lucky, this June, we'll do it in person again.
That's right,
All right.
Lucky being the operative word.
right.
It might be a little optimistic.
Well, let's hope so, Jack.
Yeah.
Anything else on the amendment? It's a friendly amendment, so it'll just fold into the motion. Is the seconder of that motion fine with that?
Fine with that.
Okay, so it's been moved and seconded to adopt the task force and committee schedule. And we can revisit the report schedule as we move along. So it's just the task force schedule and the committee schedules. Any further discussion? Okay, all those in favor, say aye or raise your hand.
Aye.
Aye.
That passes unanimously. Anything else on the schedule that anybody wants to talk about? Okay, let's move on to items for the next task force agenda. The first one we have down here, actually the only one we have down here, is Crisis Stabilization Center opening. So Ann, do you want to
Sure.
give us some info?
We are scheduled to open the very first of next month. I think some people are going to open on the 1st, some on the 4th, but we are up to our necks right now in 1,000 details, as you can imagine, trying to get this facility up and running. So there will be a ribbon cutting ceremony of somewhat. It will be virtual with very few people, and then it will go online. And I am scheduled to do a virtual tour of it next week. We'll record that and have it available to the public, so that will be the walkthrough, so people can, see the inside of the building and such, since we won't be able to have a wonderful grand opening where people can tour and everything. We have been working with Pioneer Human Services on the detox side. They are increasing their level of care beginning in January. And so right now their work is with EMS in particular, but they will allow a direct drop off, hopefully, to this facility and not have to go to the emergency department first. And that there will be 24/7 nursing on site for the detox side. And they will, clients there will be medically monitored in their detox. So they will be given medications as needed to help with the withdrawal symptoms and get them stable, and then hopefully transferred to ongoing treatment. The mental health side, this is the one we were been talking about having an involuntary triage certification, which would allow law enforcement to drop off directly in lieu of arrest, hold somebody under the peace officer hold for up to 12 hours. And within that time, a mental health professional would assess them within 3 hours and determine whether or not it might be necessary to call in a DCR, a designated crisis responder, in case involuntary treatment is needed. The issue here, of course, was funding the operations of that. Compass Health, who's running that side of the facility, really wanted to make sure they had adequate staff in case they had to help somebody into the seclusion room that was, combative or otherwise problematic. They have been working with the 5 insurance companies, the managed care organizations, to pay, to reimburse at a higher rate. And as of last week, I believe they're 60% of the way there. So 3 out of the 5 have said they are interested in doing so. I've also been talking with our county executive's office and have started to talk with our state representatives about perhaps having Whatcom County serve as a pilot project and funded by the legislature in part to support this diversion option. There's really only one other place in the state down in Benton Franklin County that has a very small program like this. So given all of the conversations these days about diverting people with serious behavioral health from criminal justice systems, that I'm hoping this might take on some interest by the legislators and that we can get this going. And so we'll be working with our local representatives, and I'm hoping to also get Roger Goodman from down south, another state rep, to be interested in helping support that. So I think when we open the first week of January, it will still be voluntary status, but I think we are working very closely to getting it to involuntary. We also have an advisory committee for program elements for this new center. Have had very active participation from EMS, law enforcement, both the City of Bellingham Police Department as well as the Sheriff's Office, to talk about protocols and procedures. And a lot of this over the first 3 months of operation is my guess we will have a lot of bugs to work out. So this committee will be really critical in telling us what's not working, what we need to fix in terms of that. But a lot of upfront work being done to make sure that we not only can fully describe to law enforcement who they can bring here and how they can bring them here, but also communicate to the community how this can be used. So I think the other thing is we've got a drone coming out next Wednesday that will show kind of the outside and the view from above, that we'll also try to incorporate into the video so people can see it. If you haven't been out there, it really is a lovely building. We stressed with the architect that we wanted it to look kind of like a lodge, not an institution. And it really does look like a lodge. It's beautiful. So I would just say there's 1,000 details that we're working on right now. Anything from, do we have all the kitchen equipment we need, and do we have the training necessary to operate the kitchen and the new appliances, to did we forget, a desk somewhere, or lockers, or so on and so forth. I mean, it's just, as you can imagine, 1,000 details.
So Anne, are you happy?
Not yet.
I am.
Are you getting happy?
I'm looking forward to this. Right now, it is just, like I said, up to the gills in 1,000 things. And it's such a huge project. Shockingly, not everything is working as planned.
Shocking.
I know, very shocking. So,
Any questions on that? Anything else we want to see? That sparked something in my mind, and I'm wondering about. There's a lot of talks about the co-responder program that we're working on. Is that we're going to be wanting to start to talk to the task force about that in coming months, I guess next year. But I just don't know how far along we are yet on actually being able to report anything out.
well, I can give you a brief update, and maybe if I'm, maybe Jill, I will ask if you don't mind reminding me, but we actually have a very active committee working on that. They meet every single week, and very, like I said, very active. We've got BPD, including the chief, who's active every week in that. People from the sheriff's office. We still even have EMS at the table. And so we have a Gantt chart of our tasks and the timelines for which they need to be accomplished in process. We have been doing a lot of research in terms of finding out what are the programs throughout the nation currently in operation that are meeting some of the goals that we intend to meet with this expansion, and then looking at what are potential partnerships we can create, and bridges to different programs and services that can create systems. So we know we have a lot in place. We don't just have to pull a program off the shelf and implement it, that we actually already have a base. So what we need to do is figure out how to enhance what we're doing. I think the main thing I would say right now that's being discussed is that in Bellingham proper, there is interest in possibility to actually have an alternative dispatch to 911 law enforcement response. So basically a team of unarmed professionals. Not quite so possible relative to the county, especially the sheriff's office, simply because if an unarmed team is in the far reaches of our county and a need for immediate backup is needed, it would not be an immediate response. And so, as you can imagine, safety is the first thing on the list. We're not going to implement a program that puts people at risk. And so if we have unarmed responders, they need to be safe. And right now, we don't have that ability quite so readily out in the, like I said, the far geographic regions of our county. So that's something we're also working on, is how do we still build the bridges to the different systems to create a bigger, greater system and make sure we keep everyone safe.
Chief Dahl has said that some people are working on how to decide to send civilians out on a call. And I'm just wondering what group is working on that.
We are. So that's part of our research. So we've got 2 data analysts doing a lot of stuff that I can't even explain well, but their charts are really impressive. And one of the things we're looking at is how many calls in which categories, and where in those calls did was there a need for a higher level of police response, maybe even a use of force or something. And obviously some calls we would never send an unarmed team to, but maybe for welfare checks, for instance, of which there's plenty. Then we look at how many of those welfare checks over a certain number of years required police or an armed response or some kind of hands-on situation. And so, for instance, in that case, there was only one out of maybe 2,000 cases. Better not put that in the minutes, Jill, because I don't have that data in front of me, but it was a very small percent. And so we thought welfare checks that police often have to respond to, somebody's sleeping on the streets or appears to be unconscious or something, that maybe though that would be a set of calls where an unarmed team could go, figure out what's going on. If the person's really troubled, they can get them connected to services. That's a teeny little example, but those are the kinds of things that team is working on, is quantitative data. And then we're also doing a whole nother piece of data collection for qualitative data. And so we have ride along scheduled, we have interviews with first responders and people who have used the system as well to figure out what is their experience like and where are the points of intercept as we use in this incarceration task force.
Yeah, Mike.
Two things. The first, word of gratitude to you and all your staff, and don't ever retire. My gosh, the things you're able to brief us on and to help make, and I know you have a team of people. It's absolutely amazing to hear, and having a new asset like the Stabilization Center come on is phenomenal. My second piece, besides the gratitude, is just a question. You mentioned in Bellingham, there's an interest to actually have that at the point of 911. And I understand to some degree when you talk about the geographical spread for the sheriff's office, not so easy to implement. However, and it may be just your opinion, is if Bellingham does that, would that be scalable? And if a small city police force wanted to do that as well, say Ferndale, that's in an incorporated area, is that a scalable, in your opinion, response? And would they be able to take advantage of any of the work if Bellingham does indeed do that? Would that pave the way maybe for some other jurisdictions to possibly implement such a model?
Well, we're certainly creating a program expansion that serves the entire county, knowing that we'll have to modify it given the partners we're working with. In a city, again, it's all about safety, and that's the concern of the sheriff's office, right? If something that no one expected happens and a sheriff's deputy can't arrive on scene for 40 minutes, you know, we hate to think about those kinds of things, right? And so I think all of that is up for discussion, but the hope is that just like with Grace, it serves the entire county. We want this program, and maybe it'll be another component, a brand new component of Grace, for instance. We haven't yet even decided how we structure it, but the hope is that we could use it throughout the county. So whether you call that scaling it or just making sure that we can meet our goals, whatever, but yeah.
It would seem like the dispatch step is the most crucial in that situation, that the decision made about what kind of response is, that's determining maybe the outcome too. So is dispatch connected to the North Sound behavioral health funding? Is that coming from them, or is it our county?
The current law enforcement dispatch is out of Whatcom, which is doesn't have anything to do with the North Sound Behavioral Health Administration.
Okay.
But the current unarmed dispatch system that we have now for behavioral health is fully funded from the North Sound Behavioral Health Administrative Service Organization. And obviously we have the manager of that program, those services on this team as well. So we do have an unarmed dispatch system now, we just want to expand the,
Yeah, I didn't
breadth of that.
I didn't know we had an unarmed dispatch.
And it's dispatched, it's the mobile crisis outreach team, and it's the designated crisis responders.
Okay.
So Ann, it sounds like that on the 4th of January, you might be able to, I mean, you would be able to give some sort of a summary of what's going on, just to keep the task force engaged.
And I'll try to get that Gantt chart to you, Jill, just so that people know what we're working on and kind of what the process is that we're going through. And then, you know, we've been talking about how to communicate this to the public, and Dan was at our last meeting yesterday, you know, talking about what I know all of you know this because you're on the task force, but, you know, we hear often from community members, we're not doing anything to to address ... right? Whatever that ... is, and it's many things. And as we are doing our work right now and looking, we're going, oh my gosh, we do so much, you know? And how do we, you know, I guess allay some of the angst our community members who are uninformed have about this? Not that we're doing enough, frankly, not that we could ever do enough, but we don't want people to think nothing is happening, because there's plenty.
What do you think is the most important way to communicate to the larger community? Because they are not getting the info. They just are not even the providers are getting the info that they need. And so it's a concern. It's vital, because why should all this work that we are doing be hidden? It doesn't make any, you know, I mean, from their point of view, it's hidden. From
Well, if
ours,
I knew that answer, it would have been done already, Arlene.
And, you know,
well,
this is not unique to this situation either. This is a countywide
I know,
problem. Yeah.
I know, but this is really important, I think.
We have a behavioral health meeting where we have behavioral health providers from throughout the county that meet with us, that I think I think it's happening next Monday, if I recall. And so, you know, we can tell all the providers and update them. But will they get that out? You know, those are higher level people. Will they get it out to all their staff? I don't know. And, you know, we put things in the paper and we talk on the radio, and we need our own TV station that everybody watches.
Don't we have that?
That everybody watches.
Oh, we don't watch it, okay.
The city has BTV 10. I mean, and more people watch that than you might think.
Oh, cool.
Barry, I have a question for Ann
Sure.
whenever we're there.
Go
It's a
ahead.
good segue with TV. So, Ann, you know, I've been back and forth with Eric at King 5. I told him to check with me the end of December. He reached out last week. We did that story at the groundbreaking 7 months ago. When can I do that, or whoever joins me with King 5? Because we can't do it after the 1st now if you've got people in there. I'm sure they'd like to go inside. Who would I coordinate that with?
Getting inside the building?
I suspect,
Or just-
I mean, we can tell them they can't if that's what it is. But I would, based on other things I've done with them, they usually like some interior shots and stuff too.
So I think we have two options.
Okay.
And Rusty Noble is the project manager with the county facilities division that is overseeing this, and he can get people in the building. It doesn't yet belong to the county, but he can work with the contractors to get you in. So we can either do that and you can go in any time before January, or we could use some of the footage. It's BTW that's doing the virtual.
I doubt, based on my experience with them, they won't want to use B-roll or other footage probably.
Okay.
Yeah,
All
that gets to, and how about the lobby? Even if there's people in there, would the lobby be accessible?
Oh, yes.
So maybe they don't need to do anything more than that. I'll send him an email and check with them. Because of the timing, I'm sure his ideal time to do the story wasn't between Christmas and New Year's. It's just a reality. But with the talk of publicity, I didn't want to lose that. The other thing I wanted to follow up on, I've spoken with several groups that are interested in the facility and asked how they can, when they can, and I apologize because I know there's already a lot on the plate. What will be very helpful is when we either have a website or a single page flyer that gives some structure, protocols, process about it, where all of us can direct people to whatever that is, Whatcom County / crisis, stabilization, whatever it is. I think that's a pretty high priority in that there will be questions right away. And it would be nice if we all could send people to the same source. And then as information changes or is updated, that source will have it, because none of us will be fully abreast of what's going on. Well, maybe you will, but most of us who are asked will not be fully abreast. So.
And you know, this has been so challenging for us because the certification of the triage, is it voluntary, is it involuntary? We have been waiting and waiting and waiting. And so we never did put anything together.
Well, and I think it could start off really simple. It could be as simple as, here's the phone number to call, more spaces available. So the people that are interested is, I've got a friend, family member, loved one that is in crisis and needs detox, or is in crisis with mental health. What's the accessibility portion and what's a reasonable expectation? I think even if it starts as simple as that, here's where you call, there's a couple of pictures. I don't think it has to be any more complex than that, because the main question I'm asked is, how do we access it?
Mm-hmm.
And more information can be there later. But I think the issue, which we've all talked about a lot, about the voluntary, involuntary, won't affect, like for right now, we're opening up, it sounds like, is not involuntary on the mental health side anyway. I don't even think we have to address it, because they would be screened. And if they're not appropriate for that facility, they would have to go to the hospital or somewhere else.
Yeah.
Raylene.
I have to apologize because what I'm asking might have already been in the works and you guys might already have it done. I've been absent for a little bit, but my question is, do we have something in place from the index committee to start tracking once the crisis stabilization opens on how many people are using the facility, how many people have been turned away, that kind of data, so that in 3 months after it's open or 6 months after it's open, we can see the effects of it.
Caleb, you want to take that one?
As far as the index committee is concerned, I don't believe that we have anything in place ready to capture that data, but Anne may know of internal tracking metrics that might be available to the index committee that could be interfaced. But off the top of my head, with what we've got incorporated in the index committee, I don't believe that data will be available through what we're currently capturing. But again, Anne may know more on that front.
So we collect that through a couple different sources. We used to collect it ourselves when we paid for the services a number of years ago. And now that the ASO is paying for this, or when they were paying for the services, they were collecting it. So they still collect it. And then the managed care organizations collect it, and it's everywhere. It's a big fat mess right now. And so we have been talking with the tenants about at least informally getting that data on a regular basis. And I think for us, we have already asked about denials. They collect that information now in terms of how many denials a month, simply because we need to figure out why and what's not working.
So
And census, daily census is the other thing we do.
On the denials, are they able to separate how it came in, whether it was from a police dispatch or a private? Is that separated when that information comes in?
So I don't think I can say any more about that right now. I have staff who've worked on this, but I don't think I'm informed enough to tell you that. Obviously, we would want to know that, and I think we ask it, but I don't know for sure.
Just something we might want to think about in the future.
Stephen.
And I'd like to go back to the Crisis Stabilization Center and ask whether, as you see it, if we go down the path of trying to set the involuntary hold up as a pilot project, would that sort of supersede the agreement of the 3 of 5 managed care organizations? Does that jeopardize the sign-on of the other two? Or is part of the pilot mandating their coverage? How does Plan A and Plan B intersect?
So bear with me because this gets complicated. So the managed care organizations are obligated to pay for people who meet medical necessity and are enrolled in their system. So they will continue to pay. And then there are people who have no Medicaid, and the administrative service organization must pay for those folks. Where we're looking for additional money is that if we do law enforcement diversion, the only way that either the ASO or those managed care organizations can pay for service is if people meet medical necessity. Now that's pretty tricky because crises are self-defined, but that doesn't keep the funders from denying, saying medical necessity didn't exist. And so in talking with the healthcare authority, they believe some people will not meet that medical necessity threshold, and yet we still want to divert them, that this is still a more appropriate placement than a jail, for instance, and that those are the people who would have no coverage, and those are the people we would want this funding to cover.
Those would be the involuntary holds?
Or voluntary, but for whatever reason didn't meet medical necessity levels.
So those two groups would be lumped together as so far unpaid for. And that's what we're trying to address.
Right. And my guess is then involuntary and involuntary hold, that maybe insurance companies would push back more and say, well, that's just a legal thing. That's not medical necessity. That's not health. We're not paying for it. I mean, I think that's where our challenges will be, and we don't want that to happen. That will tank the whole effort. So I'm really hoping to work with the state legislature on getting some funding that makes sure that 24/7, 365, this place has its operational funding fully covered, regardless of who's in those beds, or regardless of how many beds are full. I mean, in the time of COVID, maybe they're gonna, reduce their census.
So that really loops back to the whole place we started with all of this. It's not an involuntary or voluntary hold funding issue.
I don't think I followed that last comment. Sorry.
Well, what I thought you just described was the fire station of funding, not whether involuntary holds could be reimbursed for.
Right.
From
Just because somebody was taken there against their will doesn't mean they don't meet medical necessity for that level of care. Right? And so our premise is that if the providers of service believe that they've met medical necessity for that level of care, we believe the funders should pay for it. The healthcare companies, whether it's the AS or the MCOs, should be paying for that service. They deny a lot of claims, and we need to make sure that our facility is funded, and the healthcare authority thinks there will be people who will not meet medical necessity. And then we want the state to pay for a pilot project for those folks.
Mike, I think I saw your hand a minute ago.
Yeah, I just wanted to riff off Jack's comment / request about a landing page. And Barry, I was remembering, and I think it was this group that you introduced us to a county specialist, a media specialist, who might on some occasion be able to assist. And as I hear all the updates from Ann, and I know her department is really busy, is there an opportunity there to maybe address, because I think we do have a unique opportunity with an opening to get some positive press, if you will, or some news out to people. But I just wonder, is this an appropriate use of maybe his time to maybe help create that a landing page, even if not everything is known?
Well, yeah, then thanks for bringing that up, Mike. Because I'm working with the executive's office on that topic more broadly. So for instance, the Homeless Strategies Work Group now has formed a subcommittee on communications, and they would like to use that venue as well, out of the executive's office. So tomorrow I have my meeting with the executive, and that's one of my topics I'm going to bring up is, and I've already talked to him about it once. So that's why he joined us that one time, Jed Holmes. So I'm going to try to push that a little bit further and see, what we can get out of their office for support for this group and the Homeless Strategies Work Groups and those that fall outside of normal, departmental communication strategies that some of our department folks are doing. But there's things that cover more than one department, like our work with the task force and the one I mentioned before with the homeless group. So I think we can get some traction with that.
Okay, thanks.
Other questions? So it sounds like we can put the co-responder on the agenda for January 4th. Is everybody in agreement to that?
And our title for this effort is Behavioral Health Crisis Response Expansion.
Perfect.
I'm sorry, it's too many words, but I don't want to put the cart before the horse. So that's how we've been labeling it.
Sounds good. Any other thoughts of what to put on for the agenda other than committee reports and the stuff we just talked about?
Hey, I got to hop off here in a couple of minutes for a medical appointment that I have to go to. Was part of the agenda, forgive me for not remembering this, was part of the agenda today to create agenda items for the year as well, or just for January?
The title is for the next task force agenda. That's what the title of the agenda item is. So we certainly can be thinking about things that we want to do in the future too. I think that's this group's charge. So.
Okay. Hey, just before I take off here, I want to, so I agree with the unarmed, whatever words and just that long sentence that she had, agreed 100% that we should be talking about that. At some point in the near future, and it might be too early, LEAD could also update us, law enforcement assisted diversion. And then I would say, just for things for this group to think about, there's a proposed piece of legislation from Treatment First Washington that is very similar to the Oregon legislation that passed that decriminalizes all drugs in the state of Oregon. They're looking at doing something like that in the state of Washington and the legislature. So I'd like to have a heads up on that for this group. Any other pieces of legislation that are germane and relevant to the work that is being performed by the task force also would urge us to consider those things. And brought up Representative Roger Goodman. He was on our team for the MacArthur Foundation for the NACO. He's from the 45th, and he's the head of the public safety and I think public emergency response group. I'd like to invite him at some point later in the year to, not during session, but maybe after, to discuss just kind of general like legislative priorities that we could consider endorsing perhaps for the next short session in 22 or the long one in 23. So those are my items, and I apologize, I got to hop off now.
Okay, Dan, thanks a lot for being here.
Okay,
We'll talk later.
Yeah.
Anything else for the January meeting?
Well, I assume we would have the Crisis Stabilization Center update as well.
And I can check with Prosecutor Ritchie to see if he would like to do an update on LEAD. See, I don't know exactly where they're at, but I meet with him regularly as well, so I'll ask him.
And we'll be meeting virtually. So Jill, hopefully we'll have the virtual tour that we can show everybody at the meeting.
Any other business before this committee today?
I want to say, yeah, let's definitely try to do that virtual tour. That'd be great to show everyone. How long do you think it'll be in? Like under 5 minutes ish?
It depends on how fast I can walk. So,
All
It'll
right.
be probably a little longer. It's a very big building.
Okay.
Fly the drone through there.
But we're not going to have a 30-minute walkthrough. All right.
No, no.
I think however long it is, anything under 10 minutes, I think is well worth the time of the committee to watch. And
Yeah.
So I totally support that. And it might even be cool. Are you going to be voiceover narration, or is it just video?
No, I'll be recorded as I walk through and
Okay.
tell people what they're looking at.
All right. Because it might be cool. You could give us like the director's cut. We could have the actual audio with your live director's cut.
Oh, yeah.
Mike.
All right.
Blooper reel.
No, you don't. There's too many. I
That's
like the
this.
thought of it, but the attorneys in the room are already shivering.
Mike?
Barry, this is Mike. I just had one last thing. So first of all, I want to thank the steering committee for supporting adoption of a racial equity toolkit. But one of the things that leaves us, as we well know, is what do we do with that? So I want to just offer support because the chairs of the various committees are here. And as we go through the year and as we make recommendations and think about how to operationalize that, my offer of support is extended. I'm a student in this, as I've told you all, but I don't think we do our best work when we do it independently and we don't feel comfortable with what we're doing. And so it's just really key that that you know that the support's here for me. And if people don't have time to kind of ferret that out or see how it might apply, please reach out. And if I don't know, I'll see what I can do to help us get information. I do think the county may be moving in the way of a racial equity commission. We might have local tools available to us in 2021 beyond what we imagined. We really thought we'd just be leading the charge here in this group. We don't have to do it alone. And certainly if you're in a situation with your subcommittee and somebody brings that up and says, well, I don't know, we adopted it, but how do we do it? Well, I just my offer of help and support and one of thanks to the steering committee. I think it's really important. And sometimes we dive in and haven't sewed everything up. And that's okay. I'm okay with dealing with the mess. And if I can help, please do let me know.
Okay. Stephen.
Barry, I'll just follow up on Mike's comment by which I endorse and restate my email to you. My understanding was the county council resolved to join GARE. And so that raises a question to me is what's the impact of that on the task force, if any? What obligations does that put on us that are more than just beginning to try to formulate a way to implement the racial equity toolkit? And what are the council's expectations for the impact that should have on our work? I'm not necessarily trying to put you on the spot now, although I'd be glad to hear your thoughts. But I think that should be something maybe that's on the task force agenda where you can both lay out what you approved and what council expectations would be, what the ramifications for task force work are likely to be from that broader, more official step than just our adoption of the toolkit.
And those are great questions that I don't really know the answers to today anyway. But I think that's something that we do have to establish what all that means. And then with the, Dan Hamill and I are both on the kind of the steering committee for the Racial Equity Commission planning. And, we're trying to make sure that we're all moving this stuff together forward together, which is, as you know, that can be very complex because there's a lot of people working on, a lot of different oars and they're in different canoes. But I think, once we start rolling this stuff out, some of the question is going to be how do we address the council and at what pace to make sure we're successful. So I think GARE is probably a good place to start, since that's, like you said, that's things that have already been adopted. And I think this group can inform the council more than the council can inform this group, in my opinion, because we are the ones that really dug into to explore racial equity and toolkits. So maybe we need to be kind of take some responsibility for that and make sure that we, even in our reporting, that we report that out and give, our advice to the council. Just a
So-
thought.
So it doesn't seem premature in my mind, and I'll just put it out to my colleagues on the committee here, to have that as an agenda item for January 4th, where maybe you could talk about the council decision to join GARE, and what you just said, basically an invitation to the task force to support, maybe even lead a little bit the council's implementation of that decision.
Yeah, I think general expectations would be a great place to start.
Does anybody else think that would be a good thing to start talking about in January?
Caleb?
If I unmute, sorry. So I can't help as I listen here to sort of think about how some of this information might relate to the index committee and some of the things that we're trying to capture. I feel like, we're in a good place to start sort of digging into the roots of what we know we have already. There are a couple of additional data resources that are going to be available hopefully in 2021 for index to start gathering information on, and then coupled with the information that Ann already spoke about, I feel like it's kind of like we're right there to start looking at some of the information in the index committee standpoint and see through that lens and what that looks like going into 2021. So I'm curious to see. Maybe that's a component of what we discuss in the next meeting in January, but just trying to figure out what that looks like too as we go forward.
Anybody have anything else? Is there anyone we'll go to public comment. Is there anyone today with us that would like to speak, Joe?
We have 2 attendees. If anyone would like to speak, please virtually raise your hand right now. And no hands are raised at this time.
Okay, so we will close the public comment period. And anything else for the good of the order, folks? Well, I hope you all have a wonderful holiday, safe time. It's great working with you all, and it's been an interesting year. So with that, we're adjourned. See you later, folks.
Hi, everyone.